Hello, I'm Professor Anna Haas, retired professor of nephrology and ex-founder and director of the Global Kidney Academy. I've been asked by Professor Ahmed Al. Ahmed Al is a very long-standing friend and respected colleague and one of the best and finest ISN members and ISN education ambassadors to prepare two small talks for you on general aspects of clinical care for your ISN Education Ambassadors workshop in the Kirnes in Egypt. So I've prepared two talks specifically for you. They're not nephrology talks, they're general medical good practice mini talks. The first one is the 5 golden rules, or the 5 rules for good clinical care and communication with the patient. And the second one is the 5 what's, and you'll know what I'm talking about when I give you the 5 what's mini talk. Let's start with the 5 golden rules. The 5 golden rules for good clinical practice have at the center of them the relationship between the doctor and the patient. You cannot deliver good clinical practice. You cannot treat or cure or induce remission of a patient unless you have a good relationship with that patient. And the first thing in a good relationship between a doctor and his patient is to put yourself in the patient's place, to feel and to understand how he is, how he's feeling, his fears, his anxieties, and his vulnerability. The patient is ill, has a medical condition, is in front of you, who's apparently will give him the treatment and the cure and make him feel better. So he's anxious. He is not reassured until you establish this good relationship, this good link and partnership with him. In order to do this, you have to put yourself in his place and understand that. Secondly, beside putting yourself in his place and taking yourself off the perch of the big doctor, the scientist, the one who knows everything, take yourself down to his level and create a partnership. The second element of the partnership is respect. You need to respect the patient. You need to show the first sign of respect is sit with him, reassure him, and listen to what he has to say. And also listen to what he's not telling you. That he's afraid, that he's anxious, that he's vulnerable. And have compassion, have sympathy, and start this relationship with him. And continue it all through your care for this individual patient. And we'll come back to the individual. Show respect to him by the way you talk to him. You've listened to him carefully, now you need to talk to him. And talk to him gently, caringly, and with words he will understand. So, reassure him and explain to him what his condition is, how you plan to investigate it, how you plan to manage it, and how you plan to follow it up. And make him feel that he is part of your partnership. It's you on one side, him on the other side. You need to come together to form a team to improve him. That's the partnership. So you put yourself in his place, you listen carefully, you show him due respect. You don't talk at him. Don't talk at him with disrespect. You must do this. I'll give you this treatment and you come back in 2 weeks. And if you don't come back, I'll do this and I'll do that. No. You'll increase his fears. You'll increase his discomfort. You'll increase his anxiety and his vulnerability. And he will not have trust in you. You need to create the trust at the heart of the partnership. Then, you need to plan your treatment and your care plan in a personalized way. Always remember, you're not treating a condition. You're not treating a nephrotic syndrome or a rapidly progressive glomerulonephritis. You're not treating a kidney, or two kidneys for that matter. You're treating a patient, an individual patient. And always remember, there aren't two patients alike. Each patient is an individual and is unique. So your treatment has to take into consideration the patient's gender, the patient's age. A treatment of a nephrotic syndrome in a 20-year-old is not the same as in a 70, 80, or 90-year-old. You need to take into consideration the patient's comorbidities, the patient's psychological frame. If he's old, if he's depressed, if he has underlying diabetes, coronary artery disease, cancer, you will not treat him the same way as a young, bright, working 20-year-old. You will not treat a pregnant woman the same way as you treat a retired professor of nephrology. So personalize your treatment. And that's part of the good treatment plan and good clinical practice. Finally, beside respect, beside making yourself his agent, beside respect, beside the partnership that you establish with him, and beside the personalized care plan that you write with him, you discuss with him, you get his approval and his engagement to your plan that becomes the joint patient and doctor's plan. You need to be honest with the patient. You owe him or her respect. You owe him to be honest. What does it mean to be honest? Honest means many, many, many things, including the fact that if he asks you a question and you don't know the answer, don't come up with any false, fake answer. Say, look, this is an important question. I don't want to give you an answer now because I need, as a doctor, as a young nephrologist, to think about it, to check on my answer to you, and I'll come back and tell you more about it and give you an honest and truthful answer. Don't lie to the patient. The patient with a end-stage renal disease who's due to start dialysis in 2 or 3 weeks. Don't tell him, oh, dialysis is a long way. Don't worry. I can give you a potassium resin that will lower your potassium. I can give you a phosphate binder. No, inshallah, everything will be all right. No, you're lying to him. Nothing will be all right if you lie to him, because then you break that partnership. You go away from him with your lie, and he goes away from you to another doctor, and break that relationship that took you weeks and months to build. So be honest. But there are ways of being honest which are respectful, are caring, and are honest. Unfortunately, we tried everything. It looks as if your kidneys are given up. It looks as if time for dialysis and renal replacement therapy is nearing. But I will be there. We will continue to support you. I'll explain to you all there is to know about dialysis in simple terms, so I can reassure you that life on dialysis is an option. Transplantation will be another option, but don't tell a 95-year-old that transplantation will be an option, because that's a lie. If transplantation option, tell him transplantation will be an option, and we will be there for you. We will accompany you in your journey, as we did in CKD, chronic kidney disease. We will accompany you in your journey into dialysis, into transplantation, and you will not be alone. That's the key. All along, remember, the patient needs to be reassured. For you to have good clinical practice, you need to Involve yourself, involve the caring team, and most importantly, involve the patient. Come together as a caring team, full of respect, full of honesty, and this is how you'll get the best out of the patient you're trying to treat and you're trying to improve. And always remember, you put yourself in the patient's place. You are the patient's agent. Show him respect and show him honesty. Thank you very much and good luck.